think that was 5 minutes.
According to National Alliance Against Mental Illness, or NAMI, 52.9 million people today in the US are diagnosed with depression. Depression is a really concerning topic just because of the negative stigma and results of it, I guess. Someone actually commits suicide every 40 seconds, which is really horrible. And as someone who's suffered from mental illnesses like depression, I feel like I have credibility to speak on this topic. And I've also researched important psychology and psychiatry articles in relation to this topic. So I'm going to be talking about the use of medicine, psychotherapies, and hospitalization as treatments for depression. According to Mental Health Association, or America, medicine is the most common form of treatment for depression. The most common medicine for depression is antidepressants, which is pretty well known, I feel. And antidepressants reduce sad feelings and negative thoughts, and they don't like completely get rid of the negative thoughts and sad feelings, but they do reduce it, and it does help. The other type of medicine used for depression are antipsychotics, which kind of brings people back to reality and reduces like thoughts that aren't theirs. That doesn't really make any sense, but yeah. And they benefit sleep and communication. So now that I've talked about medicines in relation to depression treatments, I'm going to talk about psychotherapies, which are therapies that, like, there's a whole bunch of different types of them, and yes. But according to American Psychiatry Association, CBT is the most common form, or cognitive behavioral therapy is the most common form of psychotherapy, and it can be abbreviated to CBT. This is the basic talk therapy where therapists, normally psychologists, will talk to their patient and like help them recognize negative patterns, and it helps identify negative thinking and negative patterns, and it helps them learn new skills that could reduce the negative things. And then another type of therapy, I feel like it's seen commonly on TV, is psychodynamic therapies, which is the use of childhood memories and traumas to identify triggers and negative patterns in the adults, or I guess teenagers' life. Yeah. So now that I've talked about psychotherapies and medicines, I'm gonna talk about my last topic, hospitalization. Hospitalization is normally only for severe cases of depression. So normally people who are a harm to themselves or others, or they can only seek treatment in the hospitals, or they are unable to function without being monitored. In hospitals, patients are monitored 24/7. They're given medicine. They're put into group therapy sessions, which help them cope with their depression and their anxiety, and they also help with stress management. They're also put one-on-one with the psychologists or psychiatrists that work there, and they also help with prescribing medicine if they're a psychiatrist and reducing the negative thoughts. Now that I've talked about medicine, psychotherapies, and hospitalization, that is the end. But by receiving help, we can have our numbers reduced for the amount of people with depression and who commit suicide.